Hi, my name is Annette Stevens. I'm the health coach with Care Coordination. My role is to provide patients with education, resources. I provide motivation and accountability for any patients wanting to make a lifestyle change. Um, I also work alongside patients to help them identify any barriers that they're having that are preventing them from making these lifestyle changes and just help them set small goals that are achievable to help empower them. I also can provide an additional layer of support with patients that are prescribed any treatment plan by our primary care physicians or diabetic educators or nutritionists. Just providing a layer of support again, making sure patients understand those treatment plans, that they're adhering to them. If there's any barriers that's keeping them from adhering to the plan, kind of seeing what the stumbling block is and seeing how I might help them, or even diverting them back to the provider or the educator to further clarify what the patient needs to do. I want to share a couple success stories, a couple patients that recently stand out to me. First gentleman has been going through a lot of things in his life in the last couple years. He lost his wife, and he's never cooked for himself. So he's also a smoker and he drank a fair amount of alcohol. So he has been working through the grieving process. And when he came to me, he had already quit drinking alcohol. He was smoking 2 packs of cigarettes a day and really didn't cook for himself. His food mostly was fast food and frozen dinners. So I've been working with him on tobacco cessation, and he's done most of the work, but I'm just providing support, as I said. But he's gone from smoking 2 packs a day, and as of last week, he's down to 4 cigarettes a day. So we're continuing to work together on that. I've also helped him just with basic nutrition. He basically wanted to learn how to read nutrition labels, pay more attention to ingredients labels. He wanted to limit his sugar intake. And he just didn't know what he was looking for in those ingredient labels that were the sugar identifiers. So I helped him with that. And he was really good about reading his labels and learning how to cook. And we kind of talked about different recipes that I knew would be easy and quick recipes, like under 30 minutes. And as he just experimented and tried, he really surprised himself. And it wasn't as difficult as he thought in his mind that it was going to be. So he's doing really well. And again, we're just going to keep working together to get him to tobacco freedom very soon, hopefully. Another patient I've helped recently is an elderly woman who, again, just needed some general patient education on nutrition label reading. She actually asked me if I would meet her at her grocery store. She wanted me to see what she normally purchases and how that would compare to what she should be doing. And she basically was making good choices. She loves fish and lean proteins. It was the starchy items where she was kind of gravitating towards packaged flavored rice dishes, um, casserole type skillet um, dishes. So and all we did was really we went to the rice aisle and she pulled what she normally purchases, which was like a flavored chicken flavored packaged rice meal. And once she noticed the sodium intake or the sodium ingredients, and then we compared that to a brown rice that she could prepare and season on her own, it was just an eye opener for her, and it's just something she never would have thought to do. So she made the switch, and it's just sometimes it's as simple as that, and sometimes it takes a little bit longer. But I enjoy my role. I love seeing a patient working so hard at making lifestyle changes, and I'm just happy to share those two stories. And thank you for your time.